Good afternoon. My name's Robbin Hill. I am at the Maui Worldwide Freedom Rally on October 16th, 2021. Today I am here with what some will call a whistleblower, but what I call a hero. I'm here with someone who is just doing his job and found the courage of heart to speak out against the tyranny, against the unconstitutional actions being perpetrated by the United States of American government and its various branches. Today, I'm here with a gentleman who is very humble, so I'm going to say some things that I know he won't. I'm here today with someone who spoke truth to power, who is saving lives, and whose name is being recognized all over the place. I'm here with Abrien Aguirre. He is from Oahu. He worked on a COVID floor, and he has a very, very important story to tell. And while you're watching this, wherever you're watching this gentleman should be an inspiration to you. People are remaining silent. People remained silent during the Holocaust too. So while you're sitting at homes or you're watching this at work on the Maui Freedom TV website or on various news clips and captions, I want you to think about what your silence costs. For this man, it cost him his job. But what he gained was not only the title of whistleblower, which, thank you, sir. Thank you for that. But the title of someone willing to speak out in this time, a hero, a carer for you and your children, a fighter for freedom, a fighter for the truth. And it is an honor to interview this man. So, tell your story.
Yeah, so, I guess a lot of people know me as one of the Hawaii COVID whistleblowers. But before that, I was just a normal guy working at a skilled nursing facility as a occupational therapist. I rehab patients physically and cognitively, and I loved what I did. I loved working with the older population. I've done other settings, sports medicine, outpatient, and acute care, but the one that I felt most called to was working in the skilled nursing facility with the geriatric population. They tend to be our forgotten generation. They have amazing lives. They've lived so much of their life, and they have amazing stories. So I gravitated towards them. I was just really drawn to them for that reason. And I hope that someday as I get older, if I'm lucky, I'll be in a skilled nursing facility, and I hope to have someone that's compassionate and loving and will listen to my stories. I'm sure I'll have a bunch of crazy stories seeing what's going on in the world, right? Yeah, a few of them. But so, as I was working, I had an opportunity to work on COVID units. COVID in the very beginning, at least here in Hawaii, was seen as this real scary thing because of what the mainstream media was portraying. So no one wanted to work on these COVID units. I volunteered. I'd recently moved from Big Island to Oahu. I had started with a new company as a therapist. So I was kind of the low man on the totem pole. A lot of therapists were being furloughed and having to take time off. I didn't have any paid time off to take. I was so new. So I opted to work these COVID units because they were having a hard time finding people to work them. So I said, hey, I'll work them. Put me up there. So as I began to work on these isolated COVID units, I started to see how what was going on or what was being portrayed in the media wasn't what was happening on these COVID units. Patients weren't becoming more sick because of their COVID diagnosis. Now, these are patients anywhere between 70 and almost 100 years of age. I think the oldest patient I treated on this unit was like 96 or 97. End-stage renal failure, end-stage liver failure, congestive heart failure. They have all these disorders and diseases, some of them going out to dialysis 3 times per week, some of them dealing with cancer. Yet, despite what they were struggling with, their pre-existing conditions, their COVID diagnosis wasn't worsening their condition. So I found that to be very odd. I brought that up to some of my superiors. I brought that up to some of the nursing staff. They had no answers. They couldn't answer why none of our people were struggling with COVID. Matter of fact, most of the people up on these COVID units were asymptomatic. So other than them struggling with their already pre-existing conditions, they had no COVID symptoms. They didn't have the dry cough, they didn't have congestion, they didn't have fever, they didn't have any of this stuff. So they were placed on these COVID units. They were told, you have the worst virus in the history known to man, and you may die, and there's nothing we can do to treat you with it. All we can do is have you isolate for 14 days, and if you make it, you make it, and if you don't, you don't. That's what these patients were told. Very sad.
God's children with more honored years. And were they also not then prevented from seeing their families?
So they were definitely prevented from seeing their families. They were in an isolated unit. No one was allowed to visit them. We didn't even have an infectious disease doctor. We didn't even have a resident doctor that would go up on these units to see how these patients were doing. All the information from these units came from the 2 CNAs, the RN, and the 2 therapists that worked up on these units. Periodically, I would call patients' family members, and I would update them on how they were doing. And they would always ask me, is my loved one okay? Are they surviving? And I would tell them, yeah, they're actually doing okay. They're kind of bored up here. They don't have, any COVID symptoms. Other than their positive PCR test, there were no COVID symptoms.
Even, may I stop you right
Yep.
there? Were you familiar at that time that the PCR tests were falsified, that there's no validity and legitimacy to the PCR test? The very maker of the PCR test himself not only stated this, said that you could pull anything out that you wanted to, that we all hold, like a homogeneous mixture, we all hold things in our blood and in our bloodstream, and you turn cycles up enough, you can pull anything out. Was the doctor and nursing staff at your facility and at others at this point in time, were you aware that that the vast majority of the PCR tests were flagging falsified positives?
So I wasn't aware initially of that, but I soon became aware of that. So what happened is we were being tested twice a week, those that worked on these COVID units. We were made to print out our tests to show the negative result to our superior, which was my director of rehab at the time. When I printed out the result, it was alarming. It shocked me. As I read my printout, one, it was negative. Okay, that's always a good thing, right? Negative test. But then it went on to say that the test itself cannot differentiate or rule out a bacterial infection, a co-viral infection, and that if at some point it could determine you had SARS-CoV-2, that wouldn't necessarily mean that was the causative agent for your clinical symptoms. And again, most of those people up there had no symptoms. So it was very alarming. I brought that to my director's attention. I brought that to other coworkers' attention. They didn't even know what to say about it. There were periods where they would kind of gain clarity and say, wow, that's really strange. The fact that this test is saying it can't differentiate between anything, it can't pinpoint anything, it's not diagnostic, right? And then the fact that it says if you were to have symptoms, doesn't even mean that SARS-CoV-2 is the cause of your symptoms. They thought it was a little strange, but they dismissed it very quickly. So I found that maybe 2 weeks into my COVID experience, which explained the asymptomatic patients up there. Obviously, you have a test that's being administered on them that can't even differentiate between anything. It's not a diagnostic test. At best, it's ambiguous.
And after you brought this to people's attention, just within a few weeks of this, did things change for you? Did people's reactions towards you change? Did you feel anything different in the air, and did you keep bringing this up?
No, nothing really changed. The workers that I worked with, they knew I was on these COVID units. They knew I was a trustworthy person. They knew I had really strong work ethic. But they're so inundated with the mainstream media and the information they're getting from that. They're so inundated with hearing, oh, another one tested positive for COVID, another 2 tested positive. So at the time, all they were hearing was COVID. So all they were seeing was COVID. But they didn't treat me any differently. They commended me for working on these units. I got text messages that said how proud they were to have, someone volunteer to work on these units. But I could tell that the information they were getting and the information I was seeing firsthand wasn't the same. It's very different. It was so alarming to me that, one, we had all these people that were dealing with pre-existing conditions but weren't sick with COVID on this unit that were locked away from their family members. The patients that were extremely sick were hospice patients. They were terminally ill. They were determined to be terminally ill, before their SARS-CoV-2 diagnosis. So we knew they were going to pass away at some point. We knew some of them only had weeks to live. Yet, immediately after they passed, they were placed on the COVID death list. Very alarming. I wasn't okay with that. So I reached out to our Lieutenant Governor Josh Green on Oahu, who's a ER physician, right? You'd think the very person to reach out to, well, it was his COVID death list. He was the one placing these hospice patients on the COVID death list. So I let him know, hey, I think you're mistaken. I'm the practitioner that's actually with these patients. I know they didn't pass away of COVID. They passed away from terminal illness, cancer, whatnot.
May I stop you right
Yep.
there? So let me get this straight. You reached out to the Lieutenant Governor
Yes.
and gave him the true and correct information on how these people died, on how children of God died, which their families deserve to know the truth, and in their honor, it's deserved to be known.
Yes.
And you reached out to the governor and said, okay, they did not die from COVID. I was there. And what was the response?
There was absolutely no response. He never responded back to me. A year later, I ran into him in person, and I confronted him in person and asked him the very same question, and I got the same response, except this time he ran away from me. He was leaving a dinner function to raise money to run for governor, and I confronted him. I have it on video. I asked him, hey, what about the hospice patients that died of terminal illness that you placed on the COVID death list? He had nothing to say. He had no comment whatsoever. So that just strikes me as odd. There were so many red flags working on these units that just pointed to fraud, pointed to gross negligence. We have patients that they experienced other illnesses. They experienced urinary tract infection, UTIs. They had been treated for these things with antibiotics. But as soon as they were labeled COVID and placed on this COVID unit, even though they were exhibiting the same symptoms as a UTI, they weren't given any therapeutics. See, at the time, there was no FDA-approved therapeutics for coronavirus, which is what they were calling it. So if you were labeled coronavirus, you weren't given therapeutics for anything else. And again, you have a test that's saying if you do have symptoms, it may not be SARS-CoV-2. Here's someone with symptoms, yet they're equating everything to SARS-CoV-2 and they're not treating them. So some of the people that got sick, they were withheld treatment, and that's what caused them to get sick. One individual in particular, I watched deteriorate and die over 7 weeks. This individual passed away prematurely as a result of gross negligence from being withheld treatment. That shouldn't have happened. Had this individual been given the proper therapeutics like they were in the past, they would still be alive today probably. This person was administered supplemental oxygen, and then when supplemental oxygen wasn't enough, they were administered continuous oxygen. By the time this person passed away, they weren't even on a COVID unit. So here's a person supposedly with COVID, the worst virus in history, right, of mankind, dying of COVID, moved off of a COVID unit in general population with a roommate on continuous oxygen. And I know this because I was off the unit at the time also treating the roommate as a therapist. So I'm doing, functional mobilities and taking care of the roommate while I'm watching this person pass away next door that I saw on the COVID unit. I would stop in and I would hold this person's hand and talk to them from time to time. And I just felt so horrible about what was going on, that these people weren't being treated. If this person truly had COVID, why weren't they sent out to an acute care setting like Queen's Hospital, Kaiser, Straub, where they could have been administered proper treatment? It was all about money. It was all about that COVID diagnosis. I didn't find that out till later, that we were receiving higher reimbursement for people being labeled as COVID diagnosis and COVID death.
So I want you to repeat that, Sons of Yeshua going by. That's perfect timing. Can you repeat this last part, because it's so important? This is something that, and for obvious reasons, because if the United States of American citizens knew the truth, that, and obviously there are bigger things at stake, and people have other agendas for why this is going on, and it is also about money. Most people have not realized what you just said, sir, and it is so important, because it doesn't make sense. The numbers don't make sense. The lockdowns don't make sense. Well, on the reality of the numbers and the real infections and who really gets infected and who's really harmed, none of the shutdowns, nothing makes sense. So in order to combat that, you have to falsify things.
Yes.
So please, from your experience on the front lines of this, will you please repeat what you just said?
Yeah, so because we have an incentivized healthcare system and facilities are receiving higher reimbursement for labeling people COVID, that's all they were focused on. If a person had a urinary tract infection, which is very easily treatable with antibiotics, cortisone, steroids, if a person had a different bacterial infection, if a person had aspirated and acquired aspiration pneumonia, they could be treated adequately. But because they were labeled COVID, because there was so much incentive in labeling people COVID because we would receive higher reimbursement, these people weren't treated properly. It was the direct result of them passing away prematurely. There was another individual that was prone to aspirating and had aspirated and was treated successfully with therapeutics for that. Yet, when they were labeled COVID and placed on this COVID unit, aspiration happened because there was no speech therapist on this COVID unit. So they weren't even given proper services. They weren't even administered speech therapy, yet this person should have been receiving that sort of therapy. But because they weren't, they aspirated. That aspiration turned into aspiration pneumonia. Yet, because it was looked at as COVID, and you treat those very differently, they weren't treated at all. Treatment was withheld. That individual passed away as well. That individual, the day before they passed away, was actually finally sent out. At the 11th hour, they were sent out to an acute care facility. Well, too late. They passed away. And it was COVID, and we got higher reimbursement for it. So, you know, that's what we're facing here. Incentivized healthcare isn't anything new, but COVID is the latest, greatest thing in incentivized healthcare. It's the hot new thing. It's the moneymaker right now. And for a lot of medical facilities, it's a huge cash cow.
When the mask mandates in Hawaii occurred for Maui, it came to our purview that when the mask mandates for children playing sports happened, it came to our purview by some parents and by some concerned pediatricians that the attorneys for Kaiser met with the pediatricians here. The attorneys for Kaiser, not other doctors, not with science, but the actual attorneys, and said, you are not to write medical exemptions for children. And some of the pediatricians spoke up and they said, but we have children that have heart conditions and breathing conditions. And the lawyers said, you are not to write any medical exemptions from this facility. And from what I understand, that's Kaiser Permanente all over the United States. Why would that be, in your opinion?
You know, what's happening is a lot of people that are not practitioners, that are not clinicians, that don't set eyes or hands on patients are calling the shots right now, because they're the ones that are vested in making companies money. Medical facilities, the Board of Education, it's all financial. There's a lot of federal money out there right now, and every organization is fighting to get their hands on it. Healthcare has a little bit of an easier way of getting that money because we receive federal funds anyways through Medicare, Medicaid. But, you know, you have all these people that aren't healthcare professionals deciding what mandates should go, you know, be in place or what things should be billed for. It's ridiculous. It happened at my facility as well. You know, we had the billing department deciding which ICD-10 diagnosis codes patients should be listed under, and they were all COVID for higher reimbursement. That makes absolutely no sense. You know, a medical or a billing department manager is not a clinician. They're not a therapist, they're not a practitioner, they're not a physician. They should not be determining who's labeled as COVID. but they were doing it because it made our facility more money. So guaranteed that's going on in other organizations as well. It's the people that aren't the clinicians that are deciding, oh, we should label these people this because there's federal money to get.
And where do you think that's coming from? Where do you think the billing departments, where do you think that's coming from?
That was coming directly from the CDC. So the CDC had a list of ICD-10 diagnosis codes that were permissible to be used by our facility. Some of these codes that were being used were for patients that didn't even have a positive PCR test, but they were in a room with someone that had a positive PCR. So just on assumption, there's a code you can use if you just assume someone could have had COVID.
And your facility or hospital gets a whole lot more money.
We get a whole lot more money for that label. So if they're labeled COVID as opposed to COPD or chronic bronchitis, which is what some of these people were actually dealing with, we get a lot more money. So some of these ICD-10 diagnosis codes that were changed for higher reimbursement came after the fact, meaning those patients were no longer even in our facility. They had been out of the facility for months. They were already sent home, living independently, or they were sent to a different setting, like a care home or assisted living facility. Yet we were going back through our books, and the billing department was determining who we could place these ICD-10 codes on for COVID, just so that we could make more money. When I questioned them, I asked them, well, why are we changing these codes? This is a lot of work. Again, I was the director of rehab at this time. I asked them, why are we changing these codes? This is a lot of work for my therapist to do. You have to understand, even if changing the code is permissible for the facility, for a therapist, it's fraud. Our treatments, our plan of care, our goals for these patients have to be aligned with what we treated them for. We didn't treat these patients for COVID. We treated them for myocardial infarction. We treated them for stroke, CVA, cerebral vascular accidents. We treated them because they were post-operative hip and knee replacements. Yet months later, we're going back, changing their hip replacement code to a COVID code for higher reimbursement. Not only is that extremely unethical, it's fraud. It's flat out billing fraud, Medicare fraud, but it was so we could get at that federal money.
What pushed you over the edge?
You know,
and I can imagine it was a culmination of a lot, and finally seeing like you had enough of a picture. But what finally pushed you over? I've heard you speak some really startling numbers from the front lines.
Yeah, you know, it was just the whole picture. 8 months on COVID units, 2 isolation COVID units, a step-down COVID unit, and I saw 12 deaths. None of the 12 deaths could fully be attributed to COVID.
Hold on, can we take an intermission, you guys?
Yeah.
I'm sorry, 25 minutes and I gotta call in.
No problem.
I forgot that
No
I was
problem.
supposed to interview.